Iovance. Where is San Carlos, California, anyway? All right, 3 billion market cap, $10, 300 million shares outstanding. That's 3 billion. Iovance, a mid-sized biotech company. Let's see, 229 million in cash. Another 183 million in cash. So around 400 in cash. They actually have a bunch of equipment, interestingly. Yeah, ASTS, crazy, right? That was just yesterday we were gonna look at it. I don't know if you can buy a private stock as a non-accredited investor in a big company like that. It's Iovance. It's on the screen. Can you guys see it? Yeah, you should be able to see it. $3 billion market cap. Depreciation is just usually just straight line. You know, there's rarely salvage value of assets. I mean, this doesn't really matter for most publicly traded companies. You want your forecast to be perfect. You have to know the exact equipment, things like that. You could do it as a private company, maybe. All right, does Iovance have debt? Yeah, 1 million, not much. Okay, so basically no debt. It's around a 2.8 billion enterprise value. I did want to mention, since I mentioned not just stocks but startups, there's a great tool I use. They're not paying me or anything. They should. They should. Called Crunchbase. It's a really great tool. I think you should try it out if you haven't. It's actually got some free features, and the paid version is pretty cheap. And I use it to look up investors, especially. So, like, if you're, I don't know, let's pick a recent startup. Here we go, Figure. Figure is 70 million. And I will look at something like this, like, who is Parkway Venture Capital? Never heard of them. They've only made 49 investments. That's not a lot. But if you look at some of these other ones, like, here's an angel investor. Angel investors are usually much easier to get a hold of. These are a lot of like not well-known investors. I don't know these guys, but they've invested in a lot of companies. 172. I know a few of these guys, but I don't know these guys. Really small. 22 investments in Brooklyn. And sometimes it's a lot easier to get a firm like this to invest in your company than maybe A16Z or Sequoia or something like that. So just something to kind of think about. Yeah, I'm not looking for sponsors. I don't need sponsors or ads. That's why people watch me, because I've actually done it. Anybody who needs a sponsor or an ad is a faker. I don't know Biotherapeutics. I don't care about Bitcoin miners. Is this the Bezos funded one? Gene therapy has just been a fucking bust, man. NASH gene therapy? Come on. 270. I mean, this is a crossover, right? These guys will be public very soon, I assume. Patient Square Capital? Literally not heard of them. I wonder what that is. Patient Square Capital. Who the... KKR guy. Yeah, big team. Huge team. These guys want to be like Orbimed. I wonder how much capital they do have. Apollo Therapeutics, also led by this firm. Interesting. So it looks like they do PE and just like private, maybe like growth capital. Okay, first fund 4 billion, not that big. Largest first time private equity fund ever raised. Yeah, that sounds about right. 6 billion AUM. Interesting. Patient Square Capital. All right, thank you for that heads up. Okay, anyway. Consultants can be valuable. Oh, Korea is Vivek's brother. That makes sense. I remember when they started this. Okay. So Iovance has a product approved. It's called Amtagvi. I remember when this Liflacel was in clinical trials. It's selling pretty well. Amtagvi. Lifileucel. Okay. So this is for melanoma. I'll look at the label. Monitor patients for cytopenia and internal organ hemorrhage. Lovely. Inpatient. Autologous means comes from the patient. So they take your blood. Accelerated approval based on response rate. So these are for people who failed Keytruda. So second line metastatic melanoma. Cellular therapy. Administer a lymphodepleting regimen. Oh, okay, so you gotta wipe out the blood cells, replace them, administer. Wow, okay. It's like a whole regimen. So it's made for each patient. And you got to give IL-2. So you got to give cyclophosphamide. You basically have to wipe out the bone marrow. And tag V. It's amazing. You have 8% chance of dying just from taking the drug. Whew. This is a strong sucker. $156. Patient trial. Okay, so they take the patient tumor. Okay, it's 23 days, about 34 days to create the drug. So you have melanoma, you're dying, you go to the doctor, he says, I need to cut a piece of your tumor. I'm gonna send it to the lab, they're gonna make a drug just for you in 34 days. The future is here. Kind of amazing. %32 have a response. That's not that good. Only 4% have a complete response. Complete response is what it sounds like, full remission. But the duration of response is pretty good. Looks like half the patients have a decent response. So, yeah, I mean, the response rate is low for sure, 32%. But if you're dying and you basically have, at this stage, we've metastatic melanoma, failing Keytruda, I mean, what do you have, 6 months to live? You know, you don't have a lot to do at that point, right? So you have a 30% chance of response and about a 50-50 that that's going to be any good for you. Median potential follow-up for DOR is 19 months. That's a little, to me, that's a little sus because the range here says that it's about 50% at 6 to 9 months. But regardless, it's a drug, it works. And it's, I guess, selling. Was this the first quarter of sales? Let's see. I bet you it's $1 zillion. They have an interim CEO? Current? Do they sell Proleukin? Oh, they actually have Proleukin? I wanted to buy that drug too. When did they get Proleukin? Gotta buy that thing, raise it up. Okay, there's the approval, February. It's tricky, they have to like get all these centers to actually do the work to administer the drug. It's usually quite expensive. Looks like this is probably like a frontline study or something. I mean, the checkpoint inhibitor is doing most of the work here. And lung cancer is like the big indication, probably. Endometrial cancer. A couple of new potential drugs, including a different IL-2. So this will be interesting. The cost of goods is higher than the revenue. That's pretty rare for anybody that doesn't know. So I wonder what the margins at some point will probably get better. That's a little bit odd. Yeah, I would think that over time the margins will be in the 50s to 70s or 80s. We know from Kite and those other cell therapy companies. Juno, was it? Okay, so they didn't really have revenue in Q1. So all of this revenue from MTAGV is from this quarter, so 13 in revenue. Unlike most drugs, there's no stocking here, right? So all of that revenue is demand. But you would still think there's some like pent-up demand for people who wanted that treatment, although they wouldn't be living that long to be pent up. I'm just trying to gauge how popular the drug is. And we have to look at other cell therapy companies to get a sense for how well those drugs are selling. Because they're still pain in the ass to administer. Well, this is definitely one commercial launch worth watching. I think probably a lot of the value is going to come in the other indications. Abecma is not autologous though, right? It's off the shelf. So Abecma just works. This is like, you gotta go make the drug just for Mr. Smith or Mrs. Williams. And they wait for the medicine, and it costs a fortune. Let's see how much it costs actually. And tag the price. Woohoo! $500,000? Yeesh. So let me get this straight. This thing is $500,000, and you've got a 30% chance. You got a 30% chance. No, this is you got a 30% chance of getting a response. Oh yeah, you're right. You got to collect the blood. They go to a special lab. So $515,000, 30% chance of it working at all. So it's really like $1.5 million to extend your life for 6 months. Whew. Life is the most valuable thing we have. So I'm going to look at the other indications at some point and just kind of like get a sense for the efficacy potential in like lung cancer, because that's also a big indication. Be curious what the margins long term look like. Probably would be fine. You could see it being a decent long, possibly. I have to keep thinking about it. All right, somebody else for Google.